Thanks, Barbara. And thank you so much, ElderWorks, for giving us this opportunity once again to share our message of our program. Illinois SMP, my name is Jesus Enriquez, part of AgeOptions. AgeOptions is a AAA area agency in aging, helping seniors in the Cook County suburbs. And SMP program is managed by the same by AgeOptions. So here's a presentation about the general aspects of our program. So with that being said, the Illinois SMP program, the Medicare Patrol, is a statewide program managed by AgeOptions in partnership with 13 area agencies in aging in the state of Illinois. So each one of them gets separate funding and volunteers. And we have about 55 volunteers through the state of Illinois. So everybody's helping us with this program. And we are the main location in Oak Park through AgeOptions. The SMP program empowers Medicare beneficiaries, people who serve them, family members, neighbors, anybody in the community on how to protect, detect, and report cases of fraud. The ACL stands for the Administration for Community Living, provides the funding to our program in Illinois, but also in 50 states, including DC, Washington, Puerto Rico, Guam, Virgin Islands. So everywhere you go, every state, you'll have a fraud unit available. The ACL, as well as the SMP program, which is us, work in tandem in partnership with the U.S. Department of Health and Human Services and the U.S. Department of Justice to fight Medicare fraud. They are the ones who take the determination of fraud. We are the ones who, in case a beneficiary has a problem, we file a case. Through our database, it will go through those departments for any legal action or prosecution. So in other words, when people call us, they protect their benefits because they tell Medicare, hey, I was scammed. So that's that. And also the topics that we're gonna cover today through this presentation is define the meaning behind what it means healthcare fraud versus errors. We discuss the importance of reporting fraud and how your community can be affected. We review examples of potential fraud and how it looks like. And we review the COVID-19 scam trends. This has been updated more recently, so I have a new video about HHS-OIG in the Today Show, highlighting the importance of being careful when you register for your vaccine appointments. And also we have time for questions, Q&As. Please feel free to use the chat box. We dedicate some time in the end of this presentation for those questions. So first off, defining healthcare fraud. That's the first one. We always say potential because we don't want to deem everything fraudulent. We define that as billed for service you did not receive, billed for something different what you have received, billed for something that was not medically necessary. You did not need a back brace, as an example, billing for the same thing twice, and other billing errors. So if you get a lot of errors from the same provider multiple times, very often, it could lead to fraud. Now, what are the billing errors in contrast? Billing errors are a common human mistake, accidentally entering the wrong name or information, that's an example. If it's an error and not a human error, or actually it's a human error and not fraud, work with the provider to try to fix the problem. That is the sequence that anybody should follow. Contact the clinic first and rule out any errors. And if the clinic cannot solve it, or they know where it's coming from, then it could be potential fraud. There's a possibility for that. Now, we check your knowledge questions. There are about 4 questions, I believe, very easy questions. We are just gauging how much you know about the differences between fraud and error. And the first one is the definition of, and then there's a blank space there, is when somebody intentionally deceives or makes misrepresentations to obtain money or benefits from Medicare, for example. So do you think it's A for fraud, or do you think it's B for error? And feel free to shout out loud or the chat box, whatever it's more convenient for you.
A, fraud.
You think it's safe for fraud? Perfect. So let's flip the side and find out what the answer could be. So the answer is, you're right, it's fraud. It's fraud because an error is considered without intention, unintentional, and can be fixed with the help of Medicare and the provider. Fraud is an intentional act for billing for services not given or provided, services not medically necessary, or billing for the same thing twice. The question too that we have here is, billing errors will always indicate a healthcare provider or supplier intent to commit fraud. So this is a statement. So do you think the statement is A for true or B for false? I'm just giving you a couple seconds whether you think the answer could be A or B. And that one is a little bit more tricky to find that answer. But I'm gonna flip the slide so you can see that with the answer. The correct answer is false, because it's very possible that billing errors happen through Medicare without intention of committing fraud. Medicare processes thousands of claims, making beneficiaries susceptible to error. So in other words, errors don't necessarily lead to fraud. Errors can be miscommunication, or it could be inserting the wrong billing code, for example. So that's what we always say, contact your clinic to rule out any errors. So the next question, this is the biggest question that we have, and this is why this program was created. How much money do you think is lost every year due to healthcare fraud and abuse? Is it A, for 5 to 10 million, B, for 25 to 125 million, C, 10 to 20 billion dollars, or lastly, D, 60 to 100 billion dollars? So this is a multiple choice question. So you give us your answer. We'll see if you're right or not. But that's a lot. You'll be surprised with this answer. So I'm just gonna give a couple seconds. And this is the answer that we don't want to give, but we have to give, because this is the essence why this program was created and why people need to become more proactive on this. The answer, unfortunately, is $60 billion. In 2017, for instance, over $60 billion was lost to Medicare fraud, beating out any expenses in budgets of Homeland Security, NIH-sponsored medical research, college Pell Grants, NASA, EPA, and other agencies. So this money is gone. This money is not, it might be recovered a little portion of it, which is very little, but the rest of the money, it goes away. It never comes back. So the solvency of Medicare, the reason why Medicare is going up, that also could be the answer for this loss of money. So it's a lot of money, and this is why this program was created, to try to convey this message to the community, to become in the preventative aspect, protecting each other and preventing more money from being stolen and being lost. And this number was obtained with an article on their ARP bulletin board, Medicare under assault from fraudsters, back in 2018. But the amount is almost the same this year. So it hasn't gone down. It has gone up a little bit, but it stays within the same range of money. So this is one video that has information about the scam with durable medical equipment. I'm gonna play it here real quick. I think it's about 2 minutes.
If you're in pain, a free back or neck brace sounds like a good deal.
But it's really part of a multi-million-dollar scam by many different companies that are ripping taxpayers off. Pam Zeckman investigates this new scam that we're all paying for.
I realized, oops, I shouldn't have done that.
Donald gave out his Social Security number over the phone to someone he thought was from Medicare. Then he received calls about ordering braces, calls like this.
You may qualify for a knee or back brace at little to no cost to you.
Do you need a brace?
No, I'm fine. I don't need a brace.
But Medicare still paid more than $3,000 to a medical supply company for 5 braces that he didn't need and never received.
No, I'm sorry. I did not order any braces.
Over the course of 4 weeks, Mabel Fowler received 10 braces from 5 companies. Back braces, arm braces, leg braces, braces for every limb. Did you order any of these things?
No.
But Medicare has already paid more than $4,000 for the braces. All this begs the question, why didn't Medicare suspect something was wrong before approving payment for all these braces for just one person in 4 weeks?
Currently, the medical supplies phone scams are the biggest one in the state and across the country.
I feel violated, is what I feel.
Medicare is now investigating.
So as you can see, the DME, durable medical equipment, are things like knee braces, back braces, things that are assistive for people who are at home and qualify for home health services. And even if they don't qualify, they don't get home health, they need some things to recovery. So those are the things that are mostly used by scammers to lure people in to get their Medicare number and they get benefits stolen. So it's unfortunate, but it happens a lot of times. So I'm gonna open this video. I'm gonna stop the share here and I'm gonna do another share. So I'm gonna open this in a bigger screen so you guys can see it. So this is basically the Today Show is presenting one of the agents on the HHS OIG is showing the example how to be careful when register for vaccine appointments. So this is one of the examples where something also can lead to scam. So I'm gonna just play this out and I just hear the sound. So I'm just gonna play this and we'll come back. It's about 3 minutes and 50 seconds.
Available.
There you go.
Appointments in New York City, while websites like vaccinehunter.org connect people to social groups for how to score leftover shots. Some sites sending you texts or email alerts about availability and when it's your turn. Countless people crediting vaccine websites and social media for helping them secure a shot.
We wanted to build something to help everyone navigate this process in a much easier way.
While these sites and resources can be helpful, officials say be careful.
When you have a lot of non-standard processes, it's an area ripe for fraudsters to exploit.
Nanette Day is an assistant special agent in charge with the Department of Health and Human Services. How big of a concern is this for you?
We're already seeing complaints coming in where people are being charged even to make an appointment for the vaccine. There is no legitimate process that requires you to pay for the vaccine or to pay for a spot in order to get the vaccine.
Her office, along with other government agencies, have already looked into more than 96,000 potentially malicious COVID-19 websites. Like this one, spoofing vaccine maker Moderna's website, allegedly selling vaccines. At a quick glance, it seems like the real deal, but look closely and you can see Moderna is spelled wrong. The website has been disabled. The biggest concern? Social media and messages that appear to come from people you know.
Here's how a scheme could go. I get a contact from a friend of mine who I don't realize their account has been hacked. And this friend says, hey, I was able to get a leftover vaccine. I just had to pay $200 to this guy. Contact him and give him your information.
Day says any unsolicited contact could be a red flag, so call and confirm in real life.
Signing up for a vaccine does require some personal information to be entered. What are some pieces of information you should never be entering on a website to secure a vaccine?
You should never be entering your credit card. That's the very first thing. You shouldn't be ever entering things like what's your mother's maiden name, those types of security question information. And you you shouldn't be giving your social security account number either.
Another tip, make sure the web address doesn't have a dot with 2 letters at the very end, like .me. That's Montenegro.
We've already seen domains from other countries coming in saying that they're registering people for vaccination appointments in the United States.
And that's not true.
That's not true.
Depending on how you signed up, don't click on links in texts or in emails. Instead, go to the websites themselves and steer clear of anyone asking you to make an appointment for a medical exam to get the vaccine. Tips to get you vaccinated the right way and keep your personal information safe.
And get this, the special agent in charge told us about a recent case in Connecticut where someone with no ID just showed up at a home to administer a vaccine. Do not fall for that. Call your local authorities right away if that happens to you. While there have been some cases of public agencies going door to door to give shots, that would be well established and reported in your local media. It's not happening randomly. And one more note, don't forget about NBC Universal's planyourvaccine.com website. That'll help you get ready when it's your turn. You can sign up for alerts and stay up to date on vaccine news. Guys, back to you.
Vicky, thank you.
So this is one of the videos that was recently released on today's show. And it just show you how, the reality we live in. We have to be mindful, be very careful of what's out there, and most importantly, communicate these to seniors, communicate this to community residents, communicate this with vulnerable populations. It's a must. It's important to make sure the sources are credible and they are registered, they are for the government, and make sure we become more proactive, especially in these times. So that leads me to the steps we need to do in the message of our program, which is to protect, detect, and finally report. So the first step that we have here is to protect. And how we can protect ourselves from fraud. So we do it through the following things: educating ourselves on Medicare fraud and the latest trends, protect your Medicare card and social security number, use a calendar or a personal healthcare journal to record all your doctor's visits and services. Report any suspicious activity to the Illinois SMP, and that is if you have like a flyer or suspicious information about somebody that is probably doing something questionable, is fraudulent. There's a way that you can let us know, or if you get a call and it's suspicious and you wonder what to do with the call too. So there's no right and wrong question. So you can always ask us too about that. So also, additionally, this is what you should not do. Do not give your Medicare card, Medicare number, social security card, or social security number to anyone except your doctor and people who should have it. That includes government agencies, social work agencies, case workers, only those that really need that information to treat you or to seek services for you. Do not accept medical supplies or services from a door-to-door salesperson or somebody calling you on the phone, because those are unsolicited. And remember, unsolicited is something that you are never asking for. Do not allow anybody except your doctor and other Medicare providers authorized by your primary doctor to review your medical records or recommend any services. So do not accept services like that from somebody that's calling you. Now, the second step is to detect. And how do we detect? How do we do that? We have to read our Medicare summary notice, which is basically a list of services that Medicare sends in a letter to a beneficiary after 90 days of having the appointment, or explanation of benefits in case somebody has a private plan through Medicare. They get what we call explanation of benefits, which is exactly the same thing, but they get this document every 30 days. So these are the things that we need to look for here. Services or equipment you didn't receive, services or equipment not ordered by your doctor, and indiscrepancies and errors. And the Medicare summary notices are mailed every quarter, every 3 months approximately, every 90 days. You can always request a Medicare summary notice calling 1-800-Medicare. So for instance, if somebody doesn't remember who was the person that called them on the phone, they can call 1-800-Medicare and request a summary notice for that period that they might suspect the call happened. And they can get a copy of that summary notice, and they can look to see who scammed them. So the good news is that the summary notice is the best piece of evidence in case somebody gets, a senior or anybody with Medicare gets scammed. So that's what we ask beneficiaries to do first. You can also view your electronic MSN, and that is if you don't need to call or you don't want to call the national number, you can also register through mymedicare.gov. It's free, and you can link your email, and you can get access to your benefits online. So mymedicare.gov, and is to report is another step that is important. What happens if you find something suspicious? Billions of taxpayer dollars, as well as your own, as we learn here, are going to waste each year due to Medicare and Medicaid fraud. When equipment is sent fraudulently and your doctor didn't have a say or any approval, or the doctor never found out about it, your doctor, it may harm your health. Your Medicare benefits may be used up, and in the future, when you really, really need them, it's possible that Medicare will give you a denial because Medicare will look it up and find a way to see that you already got the service. And usually the service is you got it received through the scammer. So that is unfortunate, but that happens sometimes. If you think there might be a billing or service error by your doctor or provider or clinic, please call the billing hotline of the provider or supplier to try to solve this problem as soon as you can. And if the provider or doctor will not explain, or they don't know where the charge is coming from, and you suspect fraud, you can call the Illinois SMP at AgeOptions. We have an information and assistance hotline, 1-800-699-9043. And when you call, you just need to specify you are calling SMP and leave your name and phone number, and we will call you in 1 or 2 days. Mostly it's 1 day, but we will call you back, and we will go back and forth depending on your case. So there will be a person answering the phone, and we will might ask you for a copy of your summary notice in case there's some fraud going on. Now, lastly, it's important to remember, people is so many times, but it is very necessary to say this: work with your doctor. If you need medical services or equipment, you and your doctor can take that decision. You only give your Medicare number to your doctor that you trust. Your Medicare enrolled doctor will write an order for services when it's only medically necessary. So that is that. And then the thing that is very, very important are the COVID-19 current scam trends. So this is something that is happening right now. Scams related to COVID-19 are in increase. Scammers are targeting older adults and those with serious long-term health conditions. Fraudsters are attempting to bill Medicare for sham tests or treatments related to COVID. Scams are happening through unsolicited phone calls, emails, home visits, text messaging, and of course, it's as we saw in that video, right? It are also happening online. There are also social media ads and internet offerings, as you saw in the video. They are questionable sites that they email you and tell you, oh, you qualify for the vaccine right now. Please click this link to get it. Or the Moderna fake site that you saw in that video. So those are instances where the scammers use phishing tools to make it look like it is legitimate, but it is not. So here are the tips to prevent COVID-19 scams. Do not give your Medicare number to anybody other than your doctor or healthcare provider. With that exception of the rule, though, if somebody has the red, white, and blue card to see the doctor, they need to bring the card to the vaccination site. And that is because they are asking for insurance to bill Medicare for the COVID-19 vaccine. But if they forget their Medicare card, they might be asked to provide their Social Security number. And this is guidance from the Administration for Community Living, because before we got the guidance, people reported going to a pharmacy and being asked the Social Security number, and they don't know why. Well, the Social Security number allows the pharmacies, for instance, to look you up and look your number in a national database, your Medicare number. So that's why. So protect your Medicare number and treat it like a credit card. So the credit card, anybody can charge anything if they get a hold of your card. Same thing happens through Medicare. Anybody can charge any medical services in your behalf when they get a hold of that number. Never give your Medicare number away to anybody contact you unsolicited, or call in texting or emails. Be cautious of anybody coming through your door offering free COVID testing treatment supplies. So in the videos, we saw somebody in Connecticut, in another state. They were offering home visits, trying to vaccinate people and asking for Social Security or Medicare or any information. So be aware of that. In Cook County, for instance, you know that information is coming along in their Cook County website. It will be in the news, everything for people who, for example, are homebound or they cannot leave their homes, is provided to the Cook County website. So it's provided to the government. So you know it's legit. It's not something that you get a text from out of nowhere and you never asked for. So that's that. And then tips to prevent COVID-19 scams. Don't click on and then B and then ignore. So don't click on links from sources you don't know, which could put your computer or device at risk. Be cautious when purchasing medical supplies from unverified sources, including online ads and email and phone solicitation. Ignore online offers for vaccines. If you see ads touting prevention products or cures for COVID-19, is more likely it's a scam. Now with Medicare and COVID-19, Medicare Part B, medical insurance covers COVID-19 testing when ordered by your doctor on and after February 4, 2020. Medicare covers all the necessary hospitalizations as a result of COVID-19. Medicare also has telehealth services coverage to enable beneficiaries to access their healthcare without leaving their home. Medicare covers the vaccine at no cost to you. This is very, very important. If you have a site trying to charge you for the vaccine, you can report it to the IDPH, Illinois Department of Health. As we know, in Illinois that we live in, nobody should be charged anything because they either are uninsured or insured. They shouldn't cost anything to them. And obviously Medicare will pay for the cost of the vaccine, so it shouldn't cost anything to the beneficiary. For Medicare coverage questions, contact the Senior Insurance Assistance Program, SHIP, 800-252-8966. And that is the program very similar to S&P. It's a federally funded program. They provide assistance and counseling one-on-one with Medicare. So the number is 800-252-8966. And following this with Medicare and COVID-19, once the COVID-19 is available to you, you will need 2 doses of the vaccine to be effective, depending if it's Moderna or Pfizer. When you receive your dose, make sure you schedule your second dose. So yeah, very importantly, when you go on the vaccination site, make sure you schedule the second one in there. And also, very importantly here, do not take a picture with you and the vaccination card. The reason why is that any information, including the vaccination lot, can become available to anybody, and they can look you up, and some scammer might call you back and say, okay, are you getting your second dose? Can I have your social or Medicare number? And obviously, you might be willing to provide that information. So in other words, to avoid that from happening, just don't show your vaccination card when you're taking pictures. So that's important advice. So state governments are handling the distribution of COVID-19 vaccines. IDPH, Illinois Department of Health, look for updates from your state. In Illinois, you can visit coronavirus.illinois.gov. So if you guys didn't know about the site existed, it's important to spread the word about this website. This is a statewide website by the government in Illinois and IDPH in the Illinois Department of Public Health, coronavirus.illinois.gov. All the information is readily available there. And then visit cdc.gov for additional trustworthy information in regards to COVID-19 vaccines and any other changes due to the pandemic. Also, if you want to stay up to date with what's happening with fraud and only healthcare related issues, the Illinois S&P Fraud Alert is the answer. So the Illinois S&P Fraud Alert, the Illinois S&P program sends fraud alerts every other Monday. These alerts contain fraud-related news articles, information about scams in Illinois and other parts of the U.S., and useful healthcare or fraud-related resources. Please share this fraud alert with colleagues, professionals in your area, and visit our website to sign up for the fraud alert in the email list. So in other words, you will just have to type in your browser, AgeOptions.org/services and programs, S&P fraud alerts. So I'm gonna show this right now. So what you basically do, I'm clicking this website, and what it's gonna do is gonna pop up the AgeOptions website. Give me 1 second here. So here is our website. So AgeOptions website, by the way, has been redesigned. Now we have a new template. We have the information is similar. So when you click on that link that I provide in the PowerPoint, you will see all the list of things that we have, like S&P fraud alerts. Where you want to register for it, all you need to do is click over here, click here to sign up for fraud alert emails. Once you do that, all you need to do is to provide your email address here and click sign up. And you'll start receiving this right up. So I highly recommend to visit the AgeOptions website and find information about our programs too as well, and information about the Illinois S&P. So let me go back here. Okay. So the next slide, it's about the future learning. So this is one of the 4 presentations we provide to the community. If you're interested in getting to know where we are, you can contact ElderWorks and we'll be happy to give you a list of things and workshops and places and times. So for the future learning, so you have an idea of what other presentations we have to offer. The next one is how to read your Medicare summary notice. We will explain you step by step on the screen what you need to look out in the look for errors or fraud using a sample Medicare summary notice. Then the next one that we have usually is the types of scams. So that one has COVID-19 scams, has more in depth, has home health, durable medical equipment, genetic testing scams. I highly recommend it. A lot of people that see that presentation learn a lot because they really didn't know how those scams are originated. And then the last one is tips to prevent Medicare fraud. It has a lot of helpful videos from the National S&P Resource Center, which is one of the centers that has information about the 50 states, including us. So yeah, it has all those videos there and explains what you need to do to prevent these issues to begin with. And then feel free to reach out to us for more information on how to obtain this presentation or to participate in these workshops. Again, you can contact ElderWorks and we'll be happy to provide this presentation if you need it. Now, with that in mind, I'm gonna put the last slide right here on the screen. This has information about the numbers that you might need for any reason. So the first one is the Illinois S&P. It's our fraud unit, 1-800-699-9043. the Social Security Administration, Centers for Medicare and Medicaid, Better Business Bureau, Federal Trade Commission, Identity Theft Hotline, Elder Care Locator, and the Illinois Senior Health Insurance Program. So that's for Medicare counseling.